Comprehensive assessment of psychological and emotional need. Domain in CHC assessment. Is there a formal diagnosis of depression, anxiety, or another mental health condition? Are there noticeable signs of persistent low mood, lack of motivation, or emotional withdrawal from activities and interactions? Do they experience inappropriate or excessive anxiety, panic attacks, or obsessive worry that impacts daily functioning? How often do they exhibit signs of agitation, distress, frustration, or emotional outbursts? And how long do these episodes typically last? How severe is their depression or anxiety? And what effect does it have on their overall health, well-being, and ability to engage in daily life? Are they able to respond positively to reassurance, or do they remain distressed despite interventions? Do they exhibit signs of emotional withdrawal, avoiding social interaction and isolating themselves? Is their withdrawal due to cognitive impairment, making it difficult to determine if they are emotionally disengaged or struggling with comprehension? Do they suffer from episodes of psychosis, including disorganized thinking, paranoia, or unusual beliefs? Do they experience hallucinations? And if so, are they auditory, visual, or tactile in nature? Are hallucinations distressing or disruptive? And are there identifiable triggers that exacerbate these experiences? Do they display delusional thinking, such as strong false beliefs about people, events, or personal circumstances? Do delusions or hallucinations lead to distress, fear, or significant changes in behavior? Are their responses to people and situations appropriate or inappropriate given the context? Do they struggle with distinguishing between reality and delusional experiences? Is there evidence of excessive reliance on prescribed medication, including sedation, drowsiness, or dependency on medication for emotional regulation? Have they been using non-prescribed drugs, alcohol, or self-medicating in response to their mental health symptoms? Have they required specialist mental health interventions in the past 6 months, including therapy, psychiatric care, or crisis intervention? What medications have been prescribed for mental health conditions? And are there any reported side effects affecting their well-being or behavior? Have there been any recent adjustments in medication or treatment plans to improve symptom management? Do they actively participate in daily activities, or do mental health difficulties significantly limit their involvement? Are they able to contribute to their care planning, express their needs, and make decisions about their well-being? Do they engage positively in one-on-one support, or do they require more intensive interventions to manage their psychological needs? Are there any risks associated with their mental health, including self-neglect, self-harm, suicidal thoughts, or aggressive behavior? Have they ever exhibited suicidal ideation, gestures, or attempts, and what measures have been put in place for their safety? Can they verbally express distress or discomfort, or do they primarily show emotional distress through behavioral changes? Is there a history of trauma, abuse, or significant life events that contribute to their current mental health condition? Have they undergone any formal psychological or psychiatric assessments? And what were the findings? Are there specific patterns of behavior or triggers that contribute to increased emotional distress? Have they displayed signs of emotional instability, mood swings, or sudden uncontrollable emotional reactions? Do they require specialist interventions from mental health professionals such as psychiatrists, psychologists, or community mental health teams? Have they experienced any previous hospitalizations or crisis admissions related to mental health concerns? Is there a history of compliance or non-compliance with mental health treatments, including medication, therapy, or behavioral strategies? Are there structured interventions in place to help them manage symptoms, such as coping strategies, behavioral therapy, or relaxation techniques? Do they have emotional and psychological support from family, caregivers, or a professional network? Has their mental health condition improved or worsened over time? Are there specific therapies, structured activities, or interventions in place to support their emotional well-being, such as group therapy, mindfulness, or occupational therapy? Is their mental health care plan comprehensive, addressing risk factors, interventions, and ongoing monitoring? Are carers trained in managing their mental health symptoms, including de-escalation techniques and emotional support strategies? Does their mental health impact their ability to perform daily activities such as personal care, meal preparation, or following routines? How does their mental health condition affect relationships with carers, family members, and peers? Are there external stressors or environmental factors that contribute to the worsening of their symptoms? Is there a need for further specialist assessment, intervention, or adjustments to their mental health care plan? Have there been any recent incidents, behavioral concerns, or crises requiring monitoring or intervention? Is the level of support they are receiving adequate to ensure emotional and psychological stability? What strategies are in place to promote engagement in social interaction, daily activities, and overall mental stimulation? Are there long-term plans for managing their mental health, including future treatments, therapeutic interventions, and support systems? Are they at risk of deterioration if mental health support is reduced or not maintained? Are there any pending specialist referrals or outstanding mental health assessments that require follow-up? What is the overall prognosis for their mental health, and how does it affect their ability to function in daily life and their care needs? Please share your thoughts in the comment section below.